Good morning, everyone, and welcome to the Advocacy webinar. It is July 12th, 2016, and we have a very full agenda for you today. My name is Brittany Sandage, and as of July of this year, I am the new SECA coordinator. I'm also the director of coalition programs. And any questions that you have today, I will be on the other side of the computer streamlining and trying to keep up with Tony if it's at all possible. Quick housekeeping note before we roll into this. In the past, we have always emailed personally your RCH certificates. Beginning today, we are trying to use the system quite differently. You will receive a link that connects you to our YouTube recorded video as well as a certificate. It will come to you roughly 2 hours after the broadcast. If for any reason you do not receive it, check your spam, and if you have any further problems, you can always reach out to me, and I'll be happy to help. So without any further ado, I will kick it over to Tony Kohler, our Assistant Director, and he will take us away.
Good morning, everybody. Thank you so much for joining us today. We have quite a bit to talk about. We're going to talk mostly about marijuana in Ohio and what this law looks like, some of the things. We've had some conversations with the folks who are going to be heading this up in the governor's office and some other legislators, some other organizations that are really starting to be out front on this and trying to understand what their role is and how they actually achieve the outcomes that are put through in this bill. So let's go forward. As you know, Ohio is the 25th state now with a medical marijuana program. The District of Columbia also has one. Pennsylvania passed a medical marijuana program earlier this year. Missouri actually defeated theirs yesterday in their House. Theirs was quite, it was basically legalization, and it was battled back despite some support from some of the legislators there. One who actually admitted that he likes to take a toke every once in a while during the, he's a legislator, so why would you, shouldn't bother anybody else. But this has a lot of ins and outs, a lot of things that that I think we can live with, perhaps, but more things I think that we can't, and I don't know, and frankly, more of the questions that we don't know, that we don't have answers to. I've been working with some folks in Canada, in Colorado, in Massachusetts and Maine, trying to get an understanding about what we really need to look at. So let's take off and see what this bill really says. Ohio's medical marijuana program will be effective September 8th of this year. It was 90 days after the signing by the governor. The governor signed it June 8th. So September 8th we'll be ready to roll on this. It must be fully operational by September of 2018, which means we must have dispensaries set up, which means we have to have a licensing process, cultivators, all that kind of stuff. We were given general guidelines by the legislature, but general, I mean absolutely very broad in what what the law says. We have rules. So what happens is this very broad law was created. Now rules have to be written for it, with three entities kind of taking a piece of the rulemaking process. The State of Ohio Board of Pharmacy is going to be doing the majority of the work on the medical side. They'll actually be operating it through the ORS system, which is the tracking system for prescription medications. So they will have to create a new section, I guess, for that. Don't know exactly how that will work. They will also have, they will also oversee what the medical pieces are in there, that those are being understood, those are being communicated, and those types of things. The Ohio Department of Commerce, they're the group, they're the entity that's going to have to come up with the seed to sale process. Talking with some folks at the state that I know, that is going to be an uphill battle. They're not going to hire new people. This is going to be additional work, trying to start a whole new system in a quite frankly a very short amount of time. And growing a federally illegal drug, and then selling it. So we go back to who actually is going to take this? You know, there have been memos in the past where the federal government, for whatever reason, has Delaware, I take for example, actually had to stop their program because the federal government sent them a letter saying that any state workers who are working on this are considered felons because they're not allowed to start those types of programs. But then you have Colorado where the federal government looks the other way. So I don't know who had a bee in his or her bonnet on that day when they were writing the Delaware letter. But this is going to be a very, very timely process, something that is not understood. You know, tracking plants, we don't track corn plants or things like that. There are fields of corn that we might look at, but we don't track plant to plant and of illegal drugs and all of this other stuff. So this is going to be something that they're ill prepared for, and it's going to be probably a lot of painful lessons in the meantime. State of Ohio Medical Board also has a piece. What they have to do, they have to come up with a 3 or 4 hour training for medical professionals who want to recommend marijuana, physicians and those types of practitioners. I don't know exactly how they're going to do this. I'm hoping that they take the training program from New York and just kind of replicate it. They have done a lot of research into that. Dave Evans is a guy that worked with the he's an attorney out in New York and worked extensively with the medical board to try to get them on some kind of training to not only give them the kind of the issues that folks will have with marijuana, but really what is the truth and not just the talk out there. What is really safe? What is it really effective for? You know, there's no such thing as a good dose or anything, so they're going to have to figure all of that out too. So those three entities are looking now and trying to work extremely hard at organizing all of this. As with most state government agencies, they work in silos, so they don't actually talk to each other. So communication, there's going to be a coordinating person who will be trying to make these three groups talk to one another, I have the greatest respect for, so I'm hopeful that she will be able to do this. But how do people get marijuana in between? Okay, so it starts September 8th, 2016. We are not going to have dispensaries. There's no rules written about dispensaries for September 8th. So between September 8th of 2016 and before September of 2018, what does medical marijuana look like? Well, basically, there's going to be something called an affirmative defense, which is that if a person, again, we don't have any physicians who can actually recommend it because the training program is not in place either. So we're going to have this affirmative defense that we just kind of are going to have this program with little to no oversight until rules get written for it. Supposedly you have to have a physician's recommendation, but if they don't have the program to legally recommend it, the training in place, I don't know how they're going to get that. They have said, well, you can get it from other states. However, that's an issue as well because it's a felony to have it cross state lines. Michigan also is our closest state. Maybe you can sneak some down from there. However, the medical marijuana program in Michigan does not allow out-of-staters to get medical marijuana, so you'd have to drive to some other state to get it, and then risk a felony as you're crossing state lines. Very, very, in my opinion, poorly thought out way of implementing this early on. So September 18th, 2016 through whenever. You've got your friend, let's see. What was interesting was a quote from Dave Burke, who was one of the senators who led this up in the Senate. How do they get it? Should they get it from the black market? Well, what was interesting is a Cleveland Plain dealer did a story and from June 30th. And he was asked, where can they get it? And he said wherever they can find it available, any source is allowed. So Jackie Borchert, who is a reporter friend of ours here at Drug Free Action Alliance, pressed that question. So any source, and in the story it says that includes drug dealers selling marijuana illegally grown here or trafficked in from elsewhere. Burke said the law does not change enforcement of laws against that activity, but was meant to help Ohio patients. Burke also went on to say, with or without the bill, that segment of law is not being enforced anyway. So basically, we're not arresting people for marijuana possession anyway, so what the heck? Let's just go forward and treat these entrepreneurs, as a nice word, or drug dealers, whichever you want to call them, to a little more money. A little more protection under the law. Again, extremely short-sighted way of making this work, and not well thought out. And that is, quite frankly, the folks that I've talked to in the governor's office are extremely worried about this initial couple of years here, because there's nothing. This was not something that the governor really wanted. It was, again, as we've spoken about before, it was something that the legislature came up with in a quite hurried fashion to basically not have the ballot initiative come on in November. But even though they had hours and hours of testimony, it was not science-based testimony for the most part. It was mostly people saying this can help my person, this can help my person, and it really wasn't science-based. So after Ohio implements, so let's move 2 years down the road. What does this look like when we actually have some rules and we actually have some kind of program that is set up? Marijuana would be available to any citizen who has a qualifying medical condition. I'll go over those in just, I think it's on the next slide. Hopefully it is. Yes, it is, in the next couple slides. There is a THC maximum. We had suggested that perhaps 3% would be a good maximum when we first started this process to legislators in both private and public meetings. But they thought, well, my gosh, we can't have 3%. Why would we want Woodstock weed? So we have a THC maximum of 35% plant matter or 70% concentrates, which is what edibles and oils and those types of things. Any age person will be able to get a medical marijuana card. If you're under the age of 18, you will have to have parental approval to have that happen. They left this open because of the young people with epilepsy and Dravet syndrome and all of those other seizure disorders that are out there. You also have to receive, as I said earlier, a recommendation from a physician who has taken a training to actually be able to be licensed or certified. You don't get a license for this, you get a certification. Certified to recommend this. And then a person has to, the physician has to obtain a report from ORS for the last 12 months that you're not a habitual drug user or an opiate user and things like that. So I don't know what exactly the rules will look like, what they care, what they're going to be specifically looking for. I'm guessing opiates and those types of things. And I guess also, as I sit here and kind of ponder on it, perhaps it is, if a person claims to have AIDS or HIV or something, you can look back in ORS and say, okay, I've seen that this person has been taking some kind of HIV medication for the last 12 months or however long. So it might be able to match whatever kind of recommendation that the doctor's giving. There's a possibility of a caregiver. I have no clue how many patients that caregiver will have. I don't know what a caregiver looks like. As far as, I know it's written in the language. It has to be someone who helps administer medical marijuana. I don't know if that's the puff puff pass. I hope that gets edited out because that's not very appropriate. But I don't know how that looks like. It also, you cannot grow it at home. So you cannot be a person who will grow marijuana at home, no plants or anything like that. But you can receive it in an oil, tinctures, plant material, edibles, and patches. I've been asked, why is plant material out there if you're not allowed to smoke it? There were some folks from the pro side who had testified that said that they like to vape the plant matter, so they left that in. But you can't smoke the medical marijuana. So kind of an interesting piece. Also, landlords cannot remove a patient because of marijuana use. So if you're someone who is trying to run a building or have a rental property or something that you want, you cannot remove a patient because of the marijuana use. So that is continued protections for patients in that respect. Also, the Board of Pharmacy must establish a program for vets and the indigent in obtaining medical marijuana. Basically, as I called it back in the election, basically this is a welfare weed. There will be lower priced or free programs for veterans or homeless or the indigent to obtain medical marijuana. Don't exactly know how that will be paid for. I'm sure some of the taxes that they take in. However, they haven't established a tax structure within the bill as well. Again, a physician must obtain training before certification. Doctors cannot recommend to themselves. That was a big problem out in Colorado until they stopped it there. Doctors actually in Colorado now have, they cannot have a medical marijuana card and a license to practice medicine in Colorado. They can't have them both at the same time. They would have to give one up. A medical marijuana dispensary cannot be within 500 feet of a school, a church, a public library, all of those types of children environments with a lot of kids there. 15% of all dispensary licenses have to go to blacks or African Americans. These are quotes. These are not my language. Blacks or African Americans, American Indians, Hispanics, or Latinos and Asians. So yeah, they want to cover that this is the minority community is not left out. All testing facilities for the first year are limited to colleges and universities. This is going to be extremely difficult because any college or university that receives federal funding cannot have medical marijuana or any kind of marijuana on their grounds. So I don't know, again, this is one of those things that the legislators thought they were smarter than everyone else and turn out to be quite ignorant on this subject. Financial institutions, what they've done is they've also set up a financial piece of this. Financial institutions are allowed to partake in the medical marijuana program, and the way they're going to do that. So banks federally are not allowed to do this, and this is why it's a cash-only business in other states. So what they're going to do here in Ohio, we're so wise, is we're going to have people who are medical marijuana patients go to the state liquor store and I can't even say it without laughing, and basically put money into an account in a state liquor store, and then what will happen is then people will go to the medical marijuana dispensary and have that money in their account, and then they can buy. So you got to go to a state liquor store, deposit money, and then you go to the dispensary and buy your stuff. So it is a crazy type of system. They think this is better than cash only. I guess in some realm it is, but at the same time I don't understand why you have to go to a state liquor store to deposit your money. It just makes zero sense to me. So what is covered? We have all of these things covered. Again, AIDS, ALS, the one that we really tried to fight against, and it was, we actually had it at one point, and then it was taken back, was the chronic and severe pain. So this is something, PTSD was added late, sickle cell anemia was added late. Again, we go back to the science on any of these, there's very little science other than pain for cancer and some spasticity with multiple sclerosis patients. Again, that's very, very low levels of THC and more of the cannabidiol and cannabinoids and those types of things, the medicinal parts of the marijuana plant. And what is funny is the research. It's not funny. It's disturbing, but it is interesting. PTSD, it does help people in the short term, so they don't have dreams and those types of things. But if you use it long term, then what happens with PTSD patients, it actually adds to their anxiety and creates a much worse situation than they already have. Like all of these things, this is something that is based on very little science and a whole lot of anecdote. So, are employers protected? Yes, you can't get unemployment if you get fired for a marijuana offense. You cannot file for workers' compensation. An employer can still fire an employee for marijuana use, and you can still adhere to your drug-free workplace. The problem, however, is not so much that. The problem lies because that's federal. The drug-free workplace is a federal policy, so that that's not been a real issue about not being able to adhere to your drug-free workplace. The problem is the numbers in Colorado show that there will be an increase of adult use. In other states, there's going to be an increase, especially of the 18 to 24-year-old age range. So will there be enough qualified workers? If you keep firing people for marijuana use, even medically, then how do you keep your workers on staff? How can you keep your workforce up to numbers so that you don't lose productivity and all of those types of things? And there's also the admission of a possibility of a lawsuit. Somebody's going to get sued over this type of stuff. So again, issues that yes, you can still have your drug-free workplace. Later on down the road, are you going to have enough workers to actually fill your workforce? So what are we missing here? What do we not know? Patients could get a 90-day supply of marijuana. What is a 90-day supply? There is no limit to that. Is it 8 pounds or is it 50 edibles? We have no idea. There's been zero language added to this. That's going to have to be done by the Board of Pharmacy. Taxes, is this going to be taxed? We don't tax other medications. How are we going to tax this? It's going to be a big fight. How many dispensaries are there going to be in the state? There is no language in there that says how many dispensaries they're allowing. That's again going to have to be during the rules process. Will there be delivery services in the state? I know that a lot of other medical states have these delivery services where it's kind of like Domino's Pizza, which I had last night, they just drive up, drop off your weed, and go on their merry way. How many patients for each caregiver? Again, this whole caregiver concept is interesting to me. Who are the cultivators? How much are they going to have to put up? What I didn't put down here is, and one I think is one of the big ones, is the advertising of this. How is this going to be advertised? Are they going to have neon signs? Are they going to be something that is advertised in your local paper or magazines or anything else? Can the Department of Commerce process applications timely? And how many? Again, how many cultivators do we have? Who are they? How many do we have? We just don't know. What is deemed child-friendly and inedible? This was something that we had extensive conversations with the governor's office about, and I told them that, they can't get an edible law passed in Colorado because if you can get a one-a-day vitamin in a gummy form for an adult, then why wouldn't you be able to get a gummy form marijuana? That's the argument that the pro-marijuana law, that the marijuana lobby has. And that is what the issue is going to be here. It's going to be a tremendous problem. Also, private schools. Yes, you can't use in public schools marijuana, but because they receive federal funding. But if they don't receive any kind of federal funding and it's truly a private school, well, they have to allow a child to use their medication like any other medication.
Tony, before we move forward with the agenda, I've got a couple of good questions coming in from our folks. The first one is just a little bit more clarification around the distance that some of these dispensaries will have to be. That's in the language. We've heard 500 feet, but what does that mean? Is that residential neighborhoods? Is that local parks? You know, what exactly is involved? And then we've got a follow-up question as well.
It would be public parks. It does not say anything about a residential neighborhood. It's schools, churches, public parks, those types of things, but it doesn't say anything. I guess, you know, could it be if your cul-de-sac or whatever does not have a public park in the back and does not have a school somewhat nearby, then I'm guessing that you could have one there. It's one of those things. It's not really stated out, so we're really unclear about that.
Thank you, Tony. Another question came in regarding some of the currently operating vape stores. In terms of if they are interested in selling or getting in on this game, what are some of the things that we need to be mindful of, some of the talking points we have to think about to speak with our community leaders to limit it?
The vaping issue, there's not been a whole lot of language about who owns dispensaries other than a doctor cannot own a dispensary. So can a cultivator own a dispensary? Yes. You would not, from what I am gathering now, again, this has to go through the rules process, marijuana would only be allowed to be sold in a dispensary. So as of now, again, this has to go through the rule process. Can a vape shop get in on this business? Right now, no. But there's so many questions about how this is all going to work, and something I know, again, the governor's office is extremely concerned about, but we just don't have answers. As far as, there's been a lot of questions about local ordinances and those types of things, frankly, this is something that I hope everyone's going to attend, or at least somehow be tuned into the next SPECA meeting, where we'll be discussing this more. It's July 19th, which is a week from today. Down, where is that, Brittany? Oh, at the Westerville Public Library. So we're going to talk more and more about this, but I think you need to educate your folks with the Rocky Mountain Hider report, with the resources from SAM, Drug-Free Action Alliance. We're in the process of creating some resources as well as a PowerPoint. I'd like to have a PowerPoint done by the end of the week that kind of goes over, where you could have an hour discussion that not only talks about the law, but some of the things that you're doing in other states, so that we can provide that for you. I'm not going to be able to get to, I've already got some commitments to communities. I'm not going to be able to get to every community, and you guys know this as well as anybody. So to provide you with a ready-made PowerPoint, that's something that we're going to have for you hopefully by the end of this week.
Final question before we move on. Do we know of any of the appointments to the commission? Do we know who they are or anything about them?
No, the appointments have to come within 30 days of September 8th. So October 8th, we will know who the latest. We will know who those people are to the commission. One has to be a physician, or two. There are two physicians, two attorneys. One of them have to be pro-marijuana on each of those. There's a public, there's a mental health professional. There's a drug treatment professional. There's a person from agriculture. There's a couple people from the business community. So there's a number, but we just don't know who those are, and they're picked by all kinds of different people. The governor has the majority of the picks, but you have a couple picks from the House Speaker. You've got a couple picks from the Senate President. You've got one pick apiece from the minority leaders in both the House and the Senate. So we just don't know who those folks are yet. All right. So what we'll do is, if you breathe and have a nice, go to Starbucks or something today, and don't get too depressed over this. We're going to do our best, and I tell you what, we'll be able to educate our communities onto this, but we have to educate them before we ask, I think, for a local ordinance, because I've seen too many people crumble during a hearing about a local ordinance during a public hearing, that we don't want people to be swayed by emotion. We have to have them based in science. We have to have them based on reason and logic and those types of things. And so we really have to educate and work with our community folks to make sure they understand what this actually means and what kind of science there is behind this, which is very little. Going on, I did have a question yesterday, and I had not gone over the Good Samaritan law, which was passed earlier in the summer, House Bill 110. So I thought I would just bring this up as a final moment here. The Good Samaritan law is a law that basically, if someone is in some kind of drug overdose and there's someone with them, most people, I guess, do not overdose by themselves. They have someone with them. So when they overdose, can that person make a phone call to get emergency folks out there to help this person get them out of overdose? Well, this Good Samaritan law was created to help in that, but there have been some people who say that this is incredibly limited. I just wanted to educate what this Good Samaritan law is. So it has passed, but these limitations do apply. We've got to help our community folks understand this. That, one of those things is within 30 days after seeking or obtaining medical assistance, the person who seeks and obtains this, has to get a screening for a referral to treatment from a community addiction services provider. So, you just aren't left with that. So what happens after that, after you get your screening, then you have to take that to your prosecuting attorney in your county to make sure that the person verifies that the person satisfied these requirements, or then, the Good Samaritan does not apply. If the caller has a probation violation, then immunity from arrest does not apply. It's only good for 2 times. The 3rd time, the law is voided out. So if you're continually with someone, then who you find yourself in situations and always seem to be with people overdosing, then you would not be protected the 3rd time. Also, one of the big issues that that was debated in the House and the Senate, was the idea that medical professionals can share with law enforcement the name and the address of the person who overdosed for further investigation and follow-up. This, again, is something that people were worried about, that those who call in will then be worried that the cops are going to try to question them and all of this kind of stuff. So so this is our Good Samaritan law. Again, people will be given immunity as long as they meet those types of requirements from the law. Again, it's a lot more limited than what some would like, but it is something that can be used in the state right now. So I do, one of the last things I just want to say, I'm 3 minutes over, is that we just have to educate and advocate. There's a couple of issues. Again, we have to educate folks that the beer limit is unlimited, make sure that parents know this, make sure that, adults know this, quite frankly, that, the craft beer is not limited anymore, or any beer kind of content. And also, so what we're probably going to have is 4 Locals probably going to move in. Their beer is 14% on average, instead of this 6.5 or whatever it is, according to what kind you drink. 4 Local is a favorite of young people, so they can get themselves into some pretty hairy situations there. So we're going to have to educate folks that this is a new law. And again, marijuana education and local ordinances. How do we educate our community leaders on that?
Thank you so much, Tony. To everyone who submitted a question, we greatly appreciate your participation. It helps to make sure we're getting you the information you need and helps us to know which hard questions to also to take forward. We had a few technical questions come through towards the very end about specific types of products that will be through the dispensaries. Tony will address those and clarify in the next legislative update so that you have a list that you can readily use. And just as a general housekeeping rule, this webcast will be online and on our YouTube channel by the close of business today for you to share with any of your concerned community members. If you need anything further from us, you know how to reach Tony, you know how to reach me. So we just thank you so much, and we hope to see you all at SPECA next week. If you still need to register, you can do so on the Drug Free Action Alliance event page. Thanks, everyone. Have a great day.